Dr. Moreno today is going to be talking about the importance of saliva testing for hormone replacement therapy. Without further ado, let's welcome Dr. Moreno. How are you this morning, sir?
Good morning. Very good. Thank you.
So can you tell me a little bit more about, what is the importance and why we should be concerned about the saliva testing when it comes to hormone therapy?
Yeah, with hormone therapy, it's very important to test before we actually start hormone therapy. Unfortunately, there's a lot of people that get put on hormone therapy without testing, and then they have a bad experience with the hormones, and then they're like, oh, no, I had bad experience with it, and I don't want to do them again, And so that person now is scarred because they were put on hormones that they weren't supposed to. They weren't individualized, or individualized, And, typically when they do hormones blindly, they give patients, one dose fits all, usually a patch or just a pill, like Premarin, and maybe that's not the right, dose or type of hormone for the patient. And that's why hormone testing is so crucial, because hormone, in comparison to saliva, there's two ways to test hormones. One is through the whole blood, through regular blood testing, LabCorp Quest, and the other one is through the saliva. The difference between the two is that saliva is more accurate because it's the free hormone, it's the active hormone that is working on the tissue. It's coming from the saliva. So it's actually the active, free, unbound hormone versus the blood, which is the total hormone. Because when hormones are, being transported in the blood, they have to be carried by certain proteins like albumin, but they're not active because they're being carried, they're bound. And then there's also free portions of the hormone. And therefore, when you check in the blood, you're checking the full bound and unbound. So you're not really checking the free, the actual fractionated active portion of the hormone. And that's where I'm going to show you an example of how that plays into a patient that we saw and the difference between the two and why it makes a difference in how you treat a patient. And because of this, we've found multiple studies that recently found that about 45% of women that are being treated with hormones are being treated with suboptimal, hormones or levels, and to the point where it's not enough to maintain memory and bone. So they're actually getting partial therapy, not the exact, therapy or individualized therapy for that person. And I usually, after I start the patients on a baseline testing with both blood and saliva, I check their and I put them on the appropriate hormones. I always start on a low dose and titrate. I recheck them after 3 months. So we're always keeping an eye on the levels as we put them on the hormones. And the hormones that you could test in the saliva are generally the sex hormones: estrogen, progesterone, testosterone, DHA, and cortisol, which is very good for adrenals. Because we could check the adrenals throughout the day, multiple samples through the saliva instead of getting multiple blood draws, So it's very convenient to do saliva testing because people could do it at home at the convenience of their own home. We have the kits in the office. And there's some hormones you can't check in the saliva, and that's like thyroid hormones or insulin or cholesterol. Those are blood. So we do a combination of both, And without further ado, I'm going to discuss a very good case that shows why we do what we do with these testing. I have a 58-year-old female that came in complaining of hot flashes, very low libido, vaginal dryness, insomnia, irritability, significant mood swings, anxiety, headaches, memory loss, depression, and has been told that she's having accelerated bone loss. She's been having so much anxiety, but she also has a history of hypothyroid and was put on Synthroid, thyroid hormone, but wasn't able to tolerate the Synthroid because she started having palpitations, started feeling like, very anxiety on the medicine, which that can happen when you put when we treat people with hormones for the thyroid without addressing the adrenals, which we'll see in this case, high cortisol. Sometimes we have to calm the adrenals before we can put on the thyroid hormone. In her case, she had really high cortisol, and we needed to fix the cortisol before we can put her on thyroid medicine. So if we look at the labs, show me which labs you have up.
The first page, sir.
Yeah, put up the first page.
Yes, sir.
So now we have her labs. You put up the first page?
Yes, sir.
I don't see it.
It's on the screen, sir. Let me.
Mm-hmm. And bear in mind that this lady had been put on hormone therapy in the past, and again wasn't able to tolerate the hormones. She had a lot of worsening side effects from the hormones, and I guess she was put on these hormones without getting tested. And so now she wants to get a second opinion as to what we should do.
Do you see in your screen right now, sir?
No, absolutely not. I don't see it.
It is up.
Yeah, unfortunately, it didn't come up.
Okay. Just tell me when I switch it, and I will switch it for you.
Yeah, they're not coming up.
I have them up in my end. I have them up. They're showing in the screen. So you just tell me which image, and I will push it to the screen, sir.
Yeah, you could put the image on estrogen.
It's there.
Yeah, estrogen was shown to be 122, which seems to be a good level on the blood. This is the blood test. Okay. And so remember, she was complaining of hot flashes, irritability, low libido, anxiety. Second thing that we saw was her testosterone. Remember, she was having low libido. Her testosterone, do you have that one up?
Yes, sir.
Was 23, which seems to be in the range. So both her estrogen and her testosterone are normal in this blood test. So this is the reason why, based on her symptoms, if somebody's not looking at other things, which we'll look at with the saliva, you'd be saying, well, her numbers look good. She don't need testosterone. She don't need estrogen. Maybe she's just anxious, and that's why she's on Xanax. The third thing that we are going to look at is cortisol. Her cortisol was high. The range is from 10 to 20, and hers was 19.6. Do you have the cortisol up?
Yes, sir.
Mm-hmm. And usually in the morning, good cortisol is between 10 and 15. Hers was a little high, and she's been under a lot of stress. Now let's look at the saliva testing for comparison.
Yes, sir.
Okay. So if you look at the saliva testing, do you have the one where it shows estrogen, testosterone, progesterone?
Yes, sir.
Okay. Now I'm kind of going blindly because I'm not sure if it's showing on your end. But as you can see here, all her estrogen levels were low. In the red, it should be right down the middle. I put a line right down the middle. That's generally where it should be, between the third and fourth, distribution or quartile, and she's below the first. It's like almost undetectable estradiol. Estradiol is the most potent, most common version of estrogen. Estrone is more of the estrogen that you get in menopause. As you can see, her estrone is becoming higher because she's in menopause. So it's a different type of estrogen that your body now makes from the adrenals and from fat, not from the ovaries. Ovaries are the ones that make estradiol primarily, which is the more active estrogen. Estrone is not as active. Same thing with estradiol, E3. That's a type of estrogen that you see more in pregnancy, and it's very good for vaginal tissue. For hydration, and remember, she has vaginal dryness. So as you can see, the saliva testing gives us all three different types of estrogen, and shows you that they're almost undetectable. But in the blood, it showed that it was 122, which is generally decent. Anything under 100 is low in blood, and hers was kind of 122. And then progesterone was kind of in the middle, but see, now progesterone on the blood test had shown undetectable. And here it's showing that there is a detection in progesterone. So as you can see, these levels do not correlate at all. The one that does correlate, if you go further down into the one with the cortisol, do you have the cortisol?
Yes, sir.
Okay, cortisol. As you can see, it gives us the level in the morning, 7 a.m. to 9 a.m. That's when it's supposed to be high. It's supposed to be in the green zone, high in the morning, but it's supposed to be low at nighttime. And she's having trouble with insomnia and anxiety throughout the day. So that second point at 10 o'clock is still kind of high. It's over the red. It should be in the green, like almost low, So that's, you're supposed to have less stress before going to bed. And and then therefore able to sleep. This is probably another reason why she's anxious, because she's not sleeping well due to this high cortisol. And then if you also look at DHEA, which is produced by the adrenals, it's very low. It's in the red. Okay. And the reason why the body's not making DHEA is because the adrenals are too busy making cortisol. They're so stressed out all day, they're not able to make DHEA. This DHEA is a pro-hormone for some of the other hormones that your ovaries don't make, especially in menopause. DHEA, your body converts to estrogen and mostly testosterone as it needs it, throughout, menopause, because, and it's very low. So she's actually in a more of a catabolic state. She's breaking down, because high cortisol causes muscle breakdown, because it's trying to get sugar. It's trying to feed itself from its body stores, and it's not making, it's not anabolic, which is building up your body, your tissues. DHEA is an anabolic. Cortisol is catabolic, so it actually breaks the muscles down. So it's just this is another reason why her testosterone was low, because she's not making any testosterone from DHEA, because it's all cortisol in the adrenals. There's some cultures that don't even go through menopause, because their adrenals are able to take over the slack from the ovaries, and they don't go through the hot flashes, but they're living a type of lifestyle that's not as stressful as the kind of lifestyle that we're having. People are recently deadlines, not sleeping well, not eating well, too much caffeine, too much cortisol. So this lady actually, we went ahead and started her on a regimen based on those levels that we saw in the saliva test, which are more accurate for the hormones that we're looking for. We were able to put her on a 2 milligram cream of estrogen. And we put her on a bias cream, which is estrol and estradiol, 2 milligram, where she puts that every morning, along with a progesterone cream that's also part of the same cream, and testosterone. Testosterone 2 milligram, progesterone 30 milligram, estrogen bias 2 milligrams. So we're able to customize a special cream based on those levels. And we have a formula on how to set up these levels or these numbers based on those results. And see, this is why we're able to customize a specialized cream for her that we would have never been able to customize based on the blood work. The only way we were able to do this is through the saliva testing. And the saliva testing is more accurate, and it goes along with her symptoms: hot flashes, low libido, low testosterone, low estrogen, insomnia, just because of the high cortisol, anxiety. So now you see why she was able to tolerate the thyroid hormone. She has high cortisol. And eventually we can put her on thyroid. So we actually were able to customize a program for her. I also put her on some adaptogen herbs like ashwagandha, rhodalia, cordyceps to help bring down cortisol. And I also put her on phosphatidylserine at nighttime to help bring down cortisol at night so she could sleep better. So these are products that we work with nutraceutical companies, and we can customize the nutritional program also along with the hormones. And we put on something called Neurocom, which is a cream. It's spray that's liposomal. That means it's got a type of technology that it gets absorbed through the mucous membranes, and it's got GABA and L-theanine. GABA helps kind of calm the brain, and L-theanine helps the brain focus, and it's also good for anxiety. And these are natural. So with this, we're going to be able to wean her off Xanax, because she was at times taking Xanax up to 4 times a day, and so between the Neurocom, to help with the spray underneath the tongue for when she's anxious, the adrenal beef, which is the adaptogen herbs, and phosphatidylserine to bring down cortisol, and then the hormones, the specialized cream that we were able to formulate based on those saliva tests. So this just shows that it's all about treating the individual and not using fixed doses. It's all about testing and using the proper test to be able to come up with the appropriate therapy for patients. So I'm real eager to see how this patient does. She'll be having a follow-up in a couple months, and then I'll keep you guys posted.
Doc, we have Dennis Walker that said good morning. Gerald say hey there. But I wanted, there is a question. You mentioned a couple times that saliva testing is accurate, but it doesn't test for everything. How accurate compared to other tests is saliva testing?
Yeah, no, saliva testing is mostly used for adrenals like cortisol, DHEA, and for sex hormones like estrogen, progesterone, testosterone, but it's not adequate for other hormones like insulin, A1Cs. It's not adequate for thyroid. Thyroid you still have to check in the blood. So we always do a combination of both. Yeah, because it's not so certain tests are not able to be done saliva, but certain tests are more accurate in saliva compared to blood. So you have to work with a functional provider, functional doctor that knows how to incorporate both types of testing. But sometimes, unfortunately with the saliva test, sometimes the insurance doesn't cover it. I know Medicare covers a particular company that we have, but sometimes we were not able to do just because of cost. We sometimes can go by the labs, the blood, because that's covered by most insurances. But a lot of times I'll even do the therapy based on the serum, and just on the blood because we're limited on able to do the saliva. Not everybody can do the saliva. That saliva test, by the way, runs about $150, which is still very reasonable compared to all the stuff that you get. And but if we can't use the saliva testing, we can still do some therapy based on the blood, but it's not as accurate. So we'll start on a special type of dosing, and then see if the patient gets better on that. And if they don't, then I definitely follow that up with a saliva test, because sometimes instead of overdosing the patient, giving them too much of something without checking it, that's the importance.
Hey, Doug. So here's another one. When you're talking about it's important with the saliva testing. When people should start concerned about hormone replacement therapy?
After their 30s. It starts happening after 30s. The levels start coming down, growth hormone. Anytime you have stress, high cortisol, you need to check your hormones, because cortisol is a disruptor, or it causes imbalances in other hormones. So when you have high cortisol, for example, in women, they're not able to ovulate, and if they don't ovulate, then they don't produce progesterone. So, typically in that case, if women are having problems with their period or having a lot of PMS, premenstrual syndrome, then I generally check their levels a week before their period to see if they're ovulated and they have progesterone. So anybody is key. Anybody's key for hormone testing, anybody, but especially after 30s or anybody under a lot of stress.
Minimum. So stress is something that a lot of people either ignore or don't feel. Some people tolerate more than others, even when it's unconscious. How often or how many times per year should we test our hormone levels?
I would say minimum once a year, just for maintenance, to make sure. I would even check them in your 20s even if you're feeling great, just to get a baseline, to find out where you are, at your best, which is in the early 20s. Unfortunately, sometimes we check people's hormones, but it's only when they're sick in their 30s or 40s. And by then we don't know what their baseline is. Their baseline is in their 20, 25, 30, when they felt good. Actually, they should get one as a good screening.
That is an excellent idea. And we're going to end with that unless you have something else, because, that's an advice that I haven't heard another doctor share. Do the test now when you're early, you feel young, you feel good, so you have a good baseline, and then you see if things are dropping. In the military, they used to do checks from day one, and then you have that history when things start coming down, hearing, eyesight, and all that. Doc, I know your time is valuable, and we really appreciate you sharing your knowledge with us these mornings. Things might change in the future. We might do not live, we might do pre-recorded videos, but it's up to the people. We just have to see how you're perceiving these live streams in the morning compared to the evening, and then we can make some decision. But in the meantime, Doc, last words?
No, just thank you very much, and stay safe.